After studying this module, you shall be able to know the meaning of the term psychogeriatrics, understand the historical background of the field of psychogeriatrics, identify the contributions of various researchers to this field, apply this knowledge to appreciate contemporary psychogeriatrics, evaluate the major developments in the field of psychogeriatrics. Old age is an important physical, social and psychological component of human life. It is a natural part of human development. Old age is accompanied by many physical changes in the body. With changing roles in family and society, old age also brings about major changes in social and family lives of people. Although different ideas related to defining old age exists, majority considers old age as beginning from the age of 65 years, and it corresponds to the generally agreed upon age of retirement and completion of professional activities in most countries. In other words, there are changes associated to the work lives of the people as well. These changes necessitate massive behavioral and social adjustments. These changes and adjustments can prove stressful and challenging for many. Aging has been the focus of many research studies the world over. The changes, adjustments and associated effects on the health and well-being of the elderly have been widely studied in the field of psychogeriatrics. We can differentiate between issues related to aging that may range from biological to psychological to chronological. Historically, the field of psychogeriatrics passed through many different stages in order to achieve its contemporary form. This module addresses the origin and historical background of the field of psychogeriatrics, along with the major developments in the different parts of the world. The field of psychogeriatrics, definition and its focus. Considering the field of psychogeriatrics, it is not easy to give a precise definition of the field. However, generally agreed upon definition of psychogeriatrics suggests that the field encompasses all the mental disorders of old age by WHO in 1972. Many are the same disorders seen early in life, modified by the process of aging. Other disorders cause impairment of function in the later phase of life. As in other fields of elderly care, psychogeriatrics involves attempts at understanding the etiology, life history, and epidemiology of diseases, treatment modalities, and finally, possible methods of prevention. However, it should be noted that nearly all mental disorders in adulthood may be combined with the effects of aging. The Merriam-Webster's dictionary defines psychogeriatrics as a branch of psychiatry concerned with behavioral and emotional disorders among the elderly. It is also known by the other terms such as geriatric psychiatry, geropsychiatry, or psychiatry of old age. This field is a subspecialty of the psychiatry dealing with the study, prevention and treatment of mental disorders in humans with old age. Another attempt to define psychogeriatrics was by Canadian Academy of Geriatric Psychiatry (CAGP) in 2007, which defined it as a psychiatric subspecialty that focuses on the assessment, diagnosis and treatment of the complex mental disorders uniquely occurring in late life. Geriatric psychiatry is focused on providing care for intensive needs patients and their caregivers at the end of their life cycle, a time when many complex physical and mental health issues called SEC resulting in a complex situation. Psychogeriatrics is the study of such behavioral and mental problems of the elderly. In older persons, physical, emotional and social changes that occur with the aging process often result in psychological problems. Common psychological disorders associated with old age are depression, delirium, dementia, psychosis, etc. These psychological problems necessitate specialized care for the elderly. Geriatric psychiatry emphasizes the biological and psychological aspects of normal aging. The psychiatric effect of acute and chronic physical illness and the biological and psychosocial aspects of pathology of primary psychiatric disturbances of older age. Geriatric psychiatrists focus on prevention, evaluation, diagnosis and treatment of mental and emotional disorders in the elderly, and the improvement of psychiatric care for healthy and ill elderly patients by American Geriatric Association. Historically, the study of changes associated with old age as well as psychological disorders of old age developed into a specialized field of study called Psycho-geriatrics. But this development was gradual and progressed slowly. The beginnings. Since the beginning of time, myths concerning the aging process and the struggle to overcome or accept death have been a component of the human history. Considering the prehistory of geriatrics in the symbolism of ancient Egypt, about 200 BC, the word old was symbolized as a person leaning on the staff, which can be characterized as the first depredation of osteoporosis. Hippocrates, based on his understanding of cardiac failure being common in old age, felt that old age was cold and wet. On the other hand, Galen considered old age as cold and dry. Roger Bacon suggested that eating a controlled and balanced diet, having proper rest, exercising, having good hygiene and moderation in lifestyle, and inhaling the breath of a young virgin could ward off old age. George Edward Day in 1815 to 1872 was a Welsh physician who put across important insights related to the anatomy and physiology of human body. Keeping in mind the perspective of the physicians on aging, he wrote a book in 1848. He mentioned that other physicians had little or no interest in knowing about aging and hence caring for the aged. From a physiological perspective, by the end of the 19th century, developments were made in the concept of hormonal reversal of the process of aging. Contribution of modern geriatrics. Psycho-geriatrics as a discipline of study had major connections to the field of study of old age, called geriatrics. The field of geriatrics was born with the invention of the word geriatrics by Ignaz Leo Nasher. He published in an article entitled Geriatrics in the New York Medical Journal in 1909, in which he wrote geriatrics from geras, old age, and itrikos relating to the physician is a term I would suggest as an addition to our vocabulary to cover the same field that is covered in old age, that is covered by the term pediatrics in childhood, to emphasize the necessity of considering senility and its diseases apart from maturity and to assign it a separate place in medicine. He wrote various articles on the topic and a book, Geriatrics, the Diseases of Old Age and Their Treatment, which was published in 1914. For developing the field of geriatrics, majorly, Warren is given much credit. She wrote 27 articles on geriatrics. In these articles, she made an attempt to introduce active rehabilitation programs, enhance the environment, and emphasize increased motivation on the part of the older person. Joseph Sheldon published a book, The Social Medicine of Aging, in 1948, in which he mentioned about the survey he did with 583 aged people. With his work, he introduced home physiotherapy for older people and promoted modification of their home environment to prevent falls. Trevor Howell called the first meeting for the Medical Society for Care of the Elderly, and in 1959 the society's name was changed to British Geriatric Society. These developments happened in the United Kingdom. The British are responsible for creating the basic principle of the field of geriatrics. Although the term originated in the USA, However, researchers of the USA worked to provide scientific validation to the principles and methods originated by the British and suggested ideas for further developing the discipline. Considering the development of modern geriatrics in the United States, Edmund Vincent Cowdrey was actively involved in research related to aging, particularly related to atherosclerosis. He edited a book in 1939, The Problems of Aging, Biological and Medical Aspects, and wrote two books, The Case of Geriatric Patient in 1958 and Aging Better in 1972. He advocated that geriatric patients need special care and even opposed American Medical Association on this point. And he was an expert in special medical needs of old patients. A number of societies were formed to highlight the need of research in the area of geriatrics. For example, the Club for Research in Aging was founded from support from the Joseph Macy Jr. Foundation in 1939, and in 1945, the Gerontological Society of America was established, and it consisted of 80 members then. The Gerontological Society published the Journal of Gerontology in 1946. Another society was the American Geriatric Society, established in 1948, and it published Journal of the American Geriatric Society. At National Institute of Health's Unit of Aging, Edward J. Stelklitz was appointed as the head in 1940, and Ruben Andries successfully led research at this unit for many years. With these and many other developments happening in the discipline, the community was driven by the perspective that the concept of aging is worthy of scientific pursuit, and that the quality of scientific research for understanding the aging process will only determine the future of humankind, by Baker in 1990. Historical background of psycho-geriatrics. This section addresses the development of the field of psycho-geriatrics from the earliest phases. Major developments in different parts of the world have been highlighted in order to have an understanding of universal impact of this branch of study. Early developments. Psycho-geriatrics was originated in 1905 by Benjamin Rush and his work. He had published the first textbook on geriatric psychiatry, an account of the body and mind in old age. One of his earliest published articles was Remarks on the Diseases of Old People. Gaub in 1906 proposed that psychiatric disorders in old age were not because of dementia. He offered the first clear point of difference between depression and dementia. G. Stanley Hall in 1922 published his groundbreaking work on senescence, the last half of life. Some other people who were responsible for the development of the field of psycho-geriatrics were Felix Pott, who was assigned as a geriatric psychiatrist at Bethlehem Hospital in 1947, and he devoted a ward to people of 60 years and above who had psychiatric disorders. Sir Martin Roth in 1955 worked on late life paranoia and described its onset. David Kay in 1962 worked on cerebrovascular disease and found its connection with depression. Developments in USA. In the USA, Psycho-geriatrics was published at Duke University in 1950s, and this program was led by Ewald Boos. This program did the Duke longitudinal studies on aging and hence was responsible for the success of those associated with it. The results of the Duke longitudinal studies started to be published in 1954. Karl Isdorfer founded another strong and successful program on psycho-geriatrics, which also produced successful researchers in the field of psycho-geriatrics. The first psycho-geriatrics monograph, called The Problem of the Aged Patient in the Public Psychiatric Hospital, was published by the Group for the Advancement of Psychiatry in 1950. Then in the mid-1960s, a committee, later called Council on Aging, was established by the American Psychiatric Association. About the similar point in the timeline, the Boston Society for Gerontological Psychiatry was founded, and it began to publish the Journal of Geriatric Psychiatry in 1967. Sanford Finkel established the American Association of Geriatric Psychiatry in 1978. The major aim of this association was to increase awareness of psychogeriatrics, to reduce stigma related to mental health, and to inform people about mental health concerns which disproportionately affect the old people. Additionally, this association focused on preventing the disorders that occur particularly in old age and promote healthy aging practices. And it publishes a journal titled the American Journal of Geriatric Psychiatry. Another association called the International Psycho-Geriatric Association was also formed in the 1980s, and it had members from the Nottingham 1980 Club. Another association which was established around the same time was the Alzheimer's Disease and Related Disorders Association, which was established in 1979, and it was responsible for the betterment of research and improved care for patients with dementia. Developments in Europe. The development of psychogeriatrics in Europe was done majorly in Austria. Most of the research on geriatric care was done in Austria in the beginning of the 20th century. Hence, it was called the powerhouse of research on geriatric care. Arnold Laurent discussed the principle of the ongoing research in Austria on geriatric care in his book Old Age Deferred, which was published in 1910. In his book, he discussed the causes of aging, which he believed were problems with immunity leading to increased infections, arteriosclerosis, and abnormalities of the secretions of the ductless gland. He suggested that having strong religious belief and being married lead to a prolonged life. And he pointed out that alcohol can be a precious gift if taken in small doses, as it is an excellent stimulant for the nervous system and the circulating system. However, he pointed out that large doses of alcohol were injurious to the entire body, especially in old age. He concluded with the fact that smoking is the worst faulty habit that can rapidly produce the signs of premature aging in young men and women. In Spain in 1948, the Spanish Society of Geriatry and Gerontology was established. Few people received proper care geriatrics units. Geriatric hospital, geriatric home care teams and inpatient. Few people received proper care geriatric units. Geriatric hospital, geriatric home care teams and inpatient geriatric consultation services. In 1978, geriatrics became a medical specialty with a training program of 4 years, which was responsible for changing the scenario of geriatric care in the country. In France, this first Psycho-geriatric society was established in 1939 by a Borgian Professor Bellis, established a university called the University of the Third Age, and it focused on research on geriatric care with special emphasis on nutrition and Alzheimer's disease. One of the researchers in the university, Bruno Wellers, has been responsible for increasing geriatric awareness throughout Europe. In Japan, the Tokyo Metropolitan Institute of Gerontology was established in 1972. This institute did research on the process of aging, with a focus on both biomedical and social science and nursing area. Although it has the longest mean lifespan and has around 110,000 people who are at least 100 years old. Japan has recognized the importance of the field of psychogeriatrics pretty late. Many hospitals lacked the basic healthcare and rehabilitation facilities needed to take care of older patients, and the patients were admitted to hospitals for relatively longer periods of time. But with a change in scenario, the special homes called Tokyo were established to take care of elderly and were run at the public expense. In 1995, the National Institute of Longevity Science was established. However, the research on the process of aging is not adequately funded in the country. One of the major contributions to the research in geriatrics was the development of the Sensin Accelerated Mouse (SAM) models by Professor Takeda at Kyoto University. These were appropriate models for studying mitochondrial dysfunction and free radical damage, and were useful for understanding memory deficits. The first International Congress of Gerontology was held in 1950 under the chairmanship of Professor Lucien Breuil in Liege, Belgium, which was attended by participants of 14 countries. The proceedings of this Congress were attended to the definition of aging. differentiation between diseases and aging, and social considerations of aging. The Second International Congress was held in 1952 under the presidency of Dr. Cowdrey in St. Louis, Missouri, which was attended by participants from 51 countries. The other parts of the world, such as Australia, Canada, were also developing the field of geriatrics in their country and funding the research related to geriatric care. With the developments in countries like USA, Britain, Japan and France, the research and development efforts were initiated in other parts of the world as well. The various fields of elderly care, such as psycho-geriatrics and other efforts related to the well-being of elderly, were recognized by the governments the world over, and policy changes were made so as to facilitate better research and development in the field. Psycho-geriatrics in India. India is a traditional society. This means that the elderly members of the society are held in high regard and respected for their wisdom and experience in life. In India, the elderly are traditionally looked after by their children, especially the sons. This means that the system of old age homes and elderly care homes is relatively less prevalent. As a result, psycho-geriatrics as a field developed quite late in our country. The developments in the field of healthcare for the elderly in India have been recent. The idea that elderly need to be provided with physical as well as mental health care is embedded in the various health systems in India, along with the healthcare planning, development and management of one of the examples is Ayurvedic, Yoga, Unani, Siddha, Homeopath, Ayush, etc. These systems of human health and well-being advocate the use of many therapeutic techniques to counter the health problems associated with old age. In the 18th century, the British had established their rule in India. The health care was then obviously dominated by the British system of medical care. Some public health plans and policies were developed and implemented during that time. But there was no distinction for older adults, and hence whatever medical treatment and care the elderly received was actually an extension to that provided to the adults. In the 20th century, particularly in 1937, a Central Advisory Board of Health was established under the Government of India Act in 1935, which granted autonomy to the states of the matter of elderly health. This advisory board was a central committee that coordinated with the Public Health Commissioner and representatives from various states in the topic of the public health activities. The Board Committee was appointed in 1943 to survey the existing position of health conditions and health organizations in the country, as well as to make provisions for the future development. Principally, the Board Committee recommended integration of all kinds of health services through a public health system, consisting of sub-centers, primary health centers, rural hospitals, district hospitals, specialist hospitals and teaching hospitals. The allopathic system of healthcare has principally developed on these bases in the country, and nearly similar emphasis is being laid down on indigenous system of medicines such as Ayush. Voluntary health agencies like NGOs, national and state health programs, unregistered medical practitioners and faith and folk healers provide additional health care support in the country. India is signatory to the Alma Ata Declaration in 1977 and thus was committed to provide health to all by the year 2000. In pursuit of this, healthcare for children and adolescents, adult women and men were categorized and developed, but healthcare for older adults was not categorized for both physical and mental healthcare, continued to be provided as for adults. Thus, the field of psycho-geriatrics is still in its nascent phase in India. Modern advances in psycho-geriatrics. The first major advancement in the field of psycho-geriatrics has been the successful attempt to codifying the geriatric assessment into a number of widely used screening tools. The first of these was developed by Dorothea Barthel in 1955. The Barthel Index was measured for all the patients who were undergoing rehabilitation at the Montebello State Hospital in Baltimore. leading to the development of standard, which was then used by the number of research and publications. This has been considered as an important step in the development of psychogeriatrics and continues to guide the path of research and development in the field to this day. The evidence that geriatric assessment and management units are effective and that geriatric assessment in the home also can improve outcomes perhaps represents the major component of the success of geriatrics in the last half of the 20th century. Within hospitals, the development of units for acute care of the elderly and innovative approaches to the management of delirium appear to be the senatorial geriatric events. With the advent of modern technologies like computer diagnostic tools and machines, the identification and diagnosis of elderly health problems has been revolutionized. A number of novel ways have been suggested for the elderly. From the therapeutic viewpoint, the importance of exercise therapy, especially resistance exercise, would appear to be the major impact area. Geriatric psychiatrists have been recommending this therapy in a big way. The role of hormones in elderly health and behavior has been widely studied. This gave rise to the practice of hormone replacement, both positive and negative. This procedure has attracted the attention of a large number of geriatricians. Somewhat biased, but the understanding of the basis of the anorexia of aging has been important. Certainly, the coining of the term sarcopenia, the understanding of its pathophysiology, and the emergence of the obese sarcopenic fat frail syndrome represent another key area of psychogeriatric endeavor. Finally, the enormous advances of medicine in general in the treatment of diseases, from cardiovascular diseases to the neuropsychiatric conditions, have had a tremendous impact on the field of psychogeriatrics. In this century, hopefully, the evidence-based medicine necessary to allow us to make appropriate treatment choices for 70, 80 and even 90-year-olds can be obtained. The increasing studies in the factors, genetic and environmental, that allows centenarians to age successfully will certainly be one of the major scientific successes in the next 50 years. In conclusion, the developments in the field of psychogeriatrics from the time the concept emerged till this day have been promising. Summary: psychogeriatrics is a psychiatric subspecialty that focuses on the assessment, diagnosis and treatment of complex mental disorders uniquely occurring in late life. Since the beginning of time, myths concerning the aging process and the struggle to overcome or accept death have been a component of the human history. Early contributions to the understanding of old age came from Egyptian literature and researchers like Galen and George Edward Day. Psychogeriatrics was originated in 1805 by Benjamin Rush. Some other people who were responsible for the development of the field of psychogeriatrics were Felix Port, Sir Martin Roth and David Kay. Major developments in the field of psychogeriatrics were seen in the countries like Britain, USA, Spain, France, Japan and Belgium. The field of psychogeriatrics is still in its nascent phase in India. The enormous advances of medicine in general in the treatment of diseases have had tremendous impact on the field of psychogeriatrics.